Hello, everyone. Welcome back to another episode of the ResearchWorks podcast. Ash, hello. How are you?
Hello, Dana. I'm very well. How are you?
Good. I'm very good.
Yeah.
It's always good to be back in the studio. I love it.
Yeah.
I love it.
Definitely the best time of the week. We get to talk to lots of really interesting people about their interesting work. And today is obviously no exception to that because we have the wonderful Dr. Katrina Kelso, speech and language pathologist, joining us all the way from Canada. Welcome, Katrina.
Welcome.
Yeah, thanks for having me, guys.
Thank you.
Nice to meet you too.
It's lovely to meet you. And thank you again for staying up late for us, keeping the brain going well into the hours of the night. We really appreciate it.
Thank you. Thank you.
My pleasure.
So today we're going to be talking about one of your recent publications, which is titled A Novel Vocabulary Intervention for Poor Comprehenders, a Single Case Study, which was published in the Journal of Clinical Practice in Speech-Language Pathology in 2022. So congratulations on your publication. And
Thank you.
before we get talking about it, which I'm very excited to do, we will tell our listeners a little bit more about you, Katrina. So Katrina is a highly experienced speech-language pathologist who's worked extensively with school-aged children with language, literacy and learning difficulties. She's worked in a range of school settings and community health prior to setting up her private practice in 1998 to cater specifically to the needs of school-aged children. Katrina completed a Masters of Education at the University of Western Australia in 2003, and recently completed a PhD at Curtin University, exploring how to better identify and treat children with reading comprehension difficulties in primary school. Katrina is currently in Canada, undergoing her postdoctoral research. And as you can see, Katrina has an exceptional amount of experience both clinically and within the context of education. So we're really excited to add the research layer to this and unpack it all today.
That's so impressive, Katrina.
Oh, thank you. Thank you.
Absolutely love it.
Yeah, very excited. So Katrina, that's our formal getting to know you, but we obviously do our informal getting to know you as well here on the ResearchWorks podcast. So our question today...
Which I'm worried about.
He gets worried about this one.
Thinking about education made me think about my childhood and made me pose this question, which I think I might regret when I tell you all my answer to it. But what's one strange thing you used to believe as a child?
Oh.
So me first?
Yeah, I think so. Go for it, Katrina. Guess first.
Okay. So this is not. I suppose it's not strange in the strange sense, but I grew up in the country, and of course it was very dark and quiet at night, and for some reason beyond me when I think about it now, I used to like reading scary books. So I really used to believe that those monsters and those terrible people that were in the books that were committing, well, they weren't crime novels, but they were doing terrible things that really were out there in the dark night. And it was so easy, should I say, to believe because it was so dark and so quiet.
All those shadows.
So, all those sounds.
All those shadows, they were all out there. And I don't know why I used to keep reading them because they really scared me.
The thrill seeker in you.
Yeah, that's right. That's right. Just came back for more. Katrina, look, I feel like I can really relate to that. And I think it reflects why these days for movies, they've got like ratings now and there's MA 15 plus. There's a reason for it because I think it scarred people like me. So when I was younger, I was probably like, I remember sort of late 80s, there was this whole influx of alien abduction movies that were coming out. And I was convinced when I was lying in bed and I could see the street light that was an alien ship coming down to get me. And there would be many sleepless nights, and I used to really think that would happen. And I do acknowledge that, every now and then lately there have been some reports of, UFO sightings. I'm like, oh, maybe it's real. I don't know. But look, it was almost debilitating when I was younger, so I did have to stop watching it. But it was everywhere. There was just, I don't know why, there were so many movies about alien abductions in the 80s. So
There was. I
not you remember?
You're absolutely right. Yes, I do.
There was no ratings. It should have been at least R18 because it was very scary.
Oh, dear. Not to mention the X-Files.
Oh, my gosh. And I was too scared to watch. I can't even hear that sound, the music playing because I'll just go,
that music. That's exactly right.
I couldn't do it. So, yes, all off from that point. I learnt my lesson. Ash, where did this come from?
Okay. So my answer has a slightly different perspective to it. So
okay.
I don't know. I'm sure you probably both remember the game show Wheel of Fortune.
Yes.
Yeah.
Yes, it was.
Done a while.
Get that? It was growing up in the country. You had very limited access to television.
Well, lots of other game shows. I think in the late 80s, early 90s, and
on at 5 o'clock.
And they were on every day of the week. Yes. And if someone won that night, they were the carryover champion.
Yes.
So they got to come back the next night and play again.
Yes.
Up until I was about 14 years old, I thought that person was called the carry-owner champion. And I just thought that was something that they named the champion for the night. And maybe it was named after someone like Mr. Carriona, who was really good at game shows or something.
I love it.
Yeah. And my best friend still likes to remind me of it to this day.
And I love how no one corrected you or told you otherwise.
No, because it sounded similar enough that people probably thought I was saying carryover champion, but it was carry-owner champion. So, yeah.
Oh, my goodness.
Like those song lyrics that everyone used to get wrong. And wasn't there a Kenny Rogers song in particular that everyone used to get the words? They thought that was something totally different to what they
I
actually
still
were.
do that. You just kind of, every time someone goes, what was that word again? I'm like, I don't know. I'm not going to say it. I'm not going to tell you.
I'm just going to mumble it enough that you kind of can work out what I'm saying.
Well, I will always think about Wheel of Fortune now when I look at you. And I'll think about the carry-owner. Yeah, it's a good one. I like it. I like how we took the scary version. We're like, monsters and aliens. We went down a bit of a dark hole there. Yours at least was still fun.
A little bit silly. That's okay. We learn. We learn.
It's a nice segue into the topic of those.
Absolutely. Yeah.
Did you do that on purpose?
I promise I didn't.
She's got good questions, this one. So, it always brings out the gold. I like it. Well, I think that is, like you said, is a good segue into what this article is all about. So very excited to talk to everyone about it. So let's just give everyone a bit of a rundown about what we'll be talking about today. So poor comprehenders have difficulty with reading comprehension despite adequate word reading accuracy and fluency. With weaknesses having been identified with lower level vocabulary and grammar skills and higher level language skills, speech pathologists need to be able to tailor their interventions to meet specific individual needs. There is, however, a lack of research on interventions for poor comprehenders. So in this case study, the team aimed to explore a pilot 8-week novel vocabulary intervention on improving word knowledge and of gains generalised to reading comprehension. With improvements having been noted, the outcomes of the study have some important implications in current clinical work and future research. Ooh, what a taste,
Dana. I know. So, Katrina, we haven't really covered the topic of comprehension as yet on the podcast. We've talked to, quite a few speech and language pathologists now, and I feel like we've touched on lots of different, areas within that domain. But let's start with comprehension. What do we mean when we're talking about comprehension and when we define comprehension? And I suppose the second part to that question is, how do we identify those who are poor comprehenders?
Right. Good question. So comprehension is essentially our ability to understand language, and that can be language in any form, whether it's spoken language or written language or sign or, think about the hieroglyphics or something like that. It's that ability to make sense of that system of language. In terms of poor comprehenders, they're quite a specific group that I was looking at rather than children or people who have poor comprehension across the board, because a lot of children, well, let's talk about children because that's who I was focusing on, will have comprehension difficulties for different reasons. But poor comprehenders are that group that Dana actually explained. So the children who can read words fluently and accurately and fluently, but they struggle to comprehend what they read. So they were like a subgroup of people who struggle with comprehension, I suppose. And I suppose it was the other side of what we're looking at in reading. I mean, comprehension is the goal of reading, and there's been lots and lots of research into children who struggle with the word reading aspect of reading, but not so much in the area of reading comprehension. And now that I've done all this work, I know why people don't study that area so much, because it's very complicated.
Yeah, I bet it is, to tease it all out, really, isn't it?
Yes.
Yeah.
And lots of different factors involved.
Yeah. And what age would we typically, or what age would we expect to start to identify poor comprehension in children?
Well, and I suppose it's poor comprehenders and poor comprehension are two different things. So that's one thing. But one of the difficulties with poor comprehension is that it's often masked, so it's quite difficult to pick up children who are struggling to comprehend. And that's the case for these poor comprehenders in the reading comprehension domain, but also in young children. And I suppose thinking back to when I worked with younger children clinically, you would do an assessment and you could find that a child had very poor listening comprehension skills, and you would go and talk to their teachers or their parents or whatever, and they go, no, they understand fine. And it's because comprehension is supported by context and gesture and all sorts of things like that. So sometimes it's not until you actually go and test a child that you can see that their ability to really understand the words and the sentences is weak. And so it can be very difficult to pick up poor comprehension in young children until they often go to school, that sort of formal aspect of kindergarten or preschool or what have you, because all of a sudden the language is shifted out of context. So you don't have all that support of home where the routines and parents can fill in the gaps, etc., etc. In the case of reading comprehension difficulties, they often don't tend to be identified until middle primary school, because the focus of the early primary years is on learning how to read the words. And so your language skills are or the text that you're reading is well within your language ability. So you're not having trouble with the comprehension. It's only when the texts start to get more difficult, and there's this sort of saying, I suppose, or for want of a better word, talking about in the early years we're looking at learning to read, and then about middle primary, so year 3 or 4, the shift is to reading to learn. And it's almost like open slather with text. There's the vocabulary stops to be controlled, and you're asked to go and explore all sorts of other topic areas. And so the complexity of the tasks, of the text, should I say, can get much more difficult, and that's when the difficulties can start to become more apparent. Clinically, just as a bit of an aside here, some of the children that I'd get referred, it was often because they started to struggle with maths. So they were actually doing quite well, but because the maths got put into word problems, so it was like problem-solving maths, they couldn't extract the maths from the word problems. Does that make sense?
So take away that context.
The kids were coming in. Yes. So if you told them the number part, the maths, they could do the maths, the algebra, but they couldn't extract that information from the word problem. So a number of children actually came to me clinically because they started to fail with maths. And some wise person said, perhaps you better go and see a speech pathologist and have a look at and explore their language skills. So there's not a simple answer to that question, I'm sorry.
No. I mean, there's lots of other questions I would like to ask us. I'll follow up to that. But I think, I'm really interested in, I suppose, how you tease that out. So in an assessment, for example, you were saying, children are learning to read and then you read to learn. But how do you identify in that reading to learn, phase of development if there are comprehension difficulties? What kinds of questions would you be asking?
Or in an assessment, well, I mean, someone's got to pick up that there's a problem there. Yeah. But if they came in for an assessment, then we would go through an assessment battery. So you can assess vocabulary, understanding of vocabulary, understanding of grammar, understanding of texts, all those sorts of things. And that's what comes out in the research when they do longitudinal studies of children. So, and there's been a couple in the United States when they've tested children in kindergarten and then tracked them over time, they can see that there's difficulties in their oral language from the early stages, but they're tracking those children and then they can see that ends up being a reading comprehension difficulty down the track. But if you're not involved in a longitudinal study, which most people aren't, then the difficulties aren't picked up until the complexity of the task and the text becomes beyond the child's capabilities. But we have lots of tests as speech-language pathologists to test those particular areas. Look, there's issues around that, and we could talk about that one for hours, but there is ways of testing those different things out.
Yeah. So in the paper that we're talking about today, you refer to two broad groups of children with poor comprehension. So can we just talk about those groups and how they are characterised?
Sure. So they're within that poor comprehender profile, so those kids who are reading words accurately and fluently but have poor comprehension of the text that they read. So there's a reasonably large body of research in that area now, and there is some debate around this, as there is in much research about these two profiles. But there seems to have been sort of these two strands of research looking at these profiles, and one is that there's a group of children that have poor vocabulary and grammar knowledge, and often we talk about, or it's referred to in the literature, I suppose, as these are being lower level language skills, and so they're further away from reading comprehension, but obviously they're the basis of communication. And those children also will have difficulty with higher level language difficulties, a higher level language skill, should I say, and then that group that just don't have the problems with vocabulary and grammar have difficulty with higher level language skills, and they're into sort of three areas. The ability to make inferences, so to fill in the gaps when information isn't provided explicitly, the ability to understand different structures of text, so that a narrative has a particular structure, which is different to a procedure, which is different to a persuasive text. And of course, they're in spoken language as well, but we tend, unless you're doing a lecture or something like that, you don't tend to think about those as having a specific as specific a structure as written language, and an area called comprehension monitoring, which is the ability to actually go, oh, I didn't understand, I need to do something about it. And these poor comprehenders have been found to be particularly poor at doing that comprehension monitoring. So there's people who argue that all poor comprehenders actually do have difficulties at the vocabulary level, but other people have done research and controlled for that and found that in fact these children do have average for age vocabulary skills.
I mean, it sounds so... I understand now why this area of research is so tricky. Even as you describe it, you kind of go, well, if you really want to assess comprehension, and when there's all this context that we give, and all the inferences that can be made from a lot of that too. I just go, wow, it is so complex because communication involves so many different means that we put into it, right? And so if you're really trying to delve into it, you kind of go, wow, what does that even look like? So what you've just described there, is that, I mean, in this paper you talk about receptive vocabulary. Is that what you mean by those sort of high level sort of language skills? Have I got that right?
No.
Okay.
And receptive vocabulary, that's not a straightforward thing either. So by receptive vocabulary, we basically mean how many words you have in your semantic store, in your lexicon, for the want of, that's the fancy word for it. But even that's not straightforward, because you can have words that you recognise, and one of the common ways we test for this is we present a sheet with 4 pictures and say a word to the child and say, point to the picture that goes best with that word. So that means that you can recognise, you recognise that word at some level.
Right.
But if you turned around, so we call that vocabulary breadth. And then you have vocabulary depth, which is a different degree of understanding of words, and that would be, okay, so now you've recognised that you know that word, but can you give me a definition of that word? Can you actually use that word in a sentence? Which is something much more complicated, and we often do that. We say, oh yeah, I've heard of that word, but how do I define it? I'm not sure that I can. And you come across that when you read. You see words, and of course, words don't operate in just as singular items. Vocabulary occurs in the context of a sentence. So you can read and you can go, okay, well, I don't really know the meaning of that word, but that from the context I can work out what this person's written or what this person said. Does that make sense? I mean, so even when we're talking about receptive vocabulary, we're talking about different.
I'm kind of thinking in relation to when I first went into research or even into health, and you're reading an article, and it's in English, and there's a lot of words or a lot of jargon used in it, and I'm reading it, and I can sort of decipher maybe what some of the words are. But then when I go back and go, what on earth was that paragraph about? I probably can't even describe it. And it takes, and there's often no context. You don't know that area well. So you just read it and you're kind of going, what does this mean? And I think as you describe in it, though I don't have the vocabulary to describe what my difficulties might be, I relate it to sort of reading that going, I can read the words. I know the meaning of some of the words. But in put all together, I don't really get what they're saying.
Draw meaning from it. And
yes, that's exactly right. And that's one of the sort of most used models of reading comprehension. It's called the simple view of reading, which says that, to comprehend, you have to be able to decode the words, but that's not enough in and of itself. You have to have the language skills, and reading comprehension is a product of the skill that you have in both areas. And you can read, there's kids who can read words, which is these poor comprehenders, but they don't understand. But then on the opposite side, you have children whose listening comprehension and their language comprehension is quite high, but they struggle to decode the words. So those kids who are sort of classically called dyslexics, they will have reading comprehension difficulties as well, but for a different reason, if that makes sense. And, of course, what you've opened up there is then the whole other Pandora's box, that we're not just talking about words and language, we're talking about how much background knowledge do you have. So if you came back to that text as you learned more about that field of research that you were reading about, then you comprehend it better over time. So background knowledge is important. You talk about words, we can have words that have different levels of meaning, so that you have the literal meaning of something and then the figurative meaning. So to be able to understand things like pull up your socks, come on, pull on, or get a wriggle on, or something or other like that. It doesn't mean that you literally have to pull up your socks or wriggle around on the floor. They have different meanings. And I was talking to a group of speech-language pathologists today about how we have a word, the word wind, for example. Now, you don't know what wind is until you put that word in a sentence, because it can be wind or wind. So there's all sorts of other factors that come into play. So I did know language is complicated, but I certainly, after delving into this, realised why people were more reluctant to explore reading comprehension or do research in the field.
You can absolutely see why this is such an area of research, because when you want to try to develop an intervention, there are so many aspects that when you put it, when you just break it down. So what is it that you're actually doing
and such
for?
From what you've explained, Katrina, such a heterogeneous problem to try and address that. To me, it sounds like, any kind of support or intervention that you would be providing to people with difficulties, with poor comprehension, has to be really individualized, because it could be, an issue at the, like you were saying, with lower level language and those building blocks, or it could be an issue with the higher level language skills, or it could be a combination of those things. So there's really not a one size fits all approach, is there?
Absolutely, yes. They're definitely a heterogeneous group, and you could, looking at the research and my own research, there wasn't a particular task or a particular skill that made that group stand out. Probably the one thing was that, on the whole, they had difficulty with auditory working memory. That seemed to be weak, and I think that's come up in one of your previous discussions, that children with language difficulties tend to have poor auditory working memory.
So the aim of your study that we're talking about today was to investigate the effect of vocabulary instruction on reading comprehension of poor comprehenders. I feel like we have a bit of a better understanding now of poor comprehenders. So what was the basis of the intervention? And from there, what were the aims of your study?
This was part of a larger body of research. So and it came out of a clinical question. This is what got me into the PhD, because I, had started looking at this area of reading comprehension, and then I'm going, well, what am I supposed to do to help these children? And from the reading I did and the people I spoke to, they said, just try a little bit of everything. And I just went, there's got to be a better answer than that, than try a little bit of, and that's logical, I suppose. But in just sort of throwing everything at them, you don't really know what's effective, what's helping the child. So looking at those two sort of different profiles of poor comprehenders, the ones that have the vocabulary and grammar difficulties as well as the higher level difficulties, is there a better approach for those children than there is for the children that seem to have average for age vocabulary and grammar skills or grammatical comprehension, and their problems were more at that higher level? So that's what I was looking to explore. Do I see these profiles when I look at a group of children, and can I develop an intervention that is different and targets those particular skill areas? And you might be going to ask this later, but it comes in at this point in time. When I looked at that group, we expected to see these two groups appear in about equal numbers with difficulties and present with those two different profiles, but unexpectedly, we didn't. We found most of the children in my research actually just had difficulty with that higher level, in that higher level comprehension area, and not a lot had difficulty with the lower level skills. And I think that is probably, I use standardised tests because that's what speech-language pathologists use clinically. So I wanted to use do something that was functional, and it potentially was something to do with using standardised tests, that they're just not sensitive enough to pick up difficulties.
That's interesting.
So in terms of the goals then, what I was trying to look at was, if we developed an intervention that targeted vocabulary specifically, could we affect change, and could we see a transfer onto tests or standardised tests of reading comprehension, because that seemed to be the difficulty, that you weren't making a change in reading comprehension, and that's because vocabulary is more distant to that whole area of reading comprehension.
Yeah. And I really wanted to ask you about your study design, because it's described as a case study, which we know, if we're looking at the hierarchy of evidence, it sits at the lower level in terms of the evidence generated. But, we acknowledge these are really unique designs, and we love, getting to learn more about them. So can you tell us why what you did was unique and what the reasoning behind the case study design was?
Well, the reason for the case study was because we didn't find many children who had vocabulary difficulties. So out of the group of children, we only found 2 that met those criteria, and only one of them agreed to participate in the intervention. So that was really just a pragmatic issue, really. But case studies definitely have their value. Of course, there are issues from a research point of view in terms of the robustness of a case study. But we did have, because it was part of a larger research program, we had a really detailed profile of this child that we gathered earlier on in the research. So this profile information was probably it was about 12 months, I think, before the intervention. And so we did end up having 2 baselines, I suppose, as such, because we had that information and then we had another baseline pre-assessment. So we could see whether that child had actually made gains, because there's developmental issues there, and and the child's in school, and so you would expect there to be change over that time. But we did have those baseline measures, and there was some progress on some of those measures in that 12-month period. But the one thing that hadn't actually shifted was her reading comprehension score. So because we use standardised tests, that there, you can look at a change over time, but the standard scores, or the normative scores, are against your age group. So it means that you're still measuring the same thing even though you're looking at it at a different point in time. So the other thing that was in the design was the use of a bespoke measure, and that came out because much of the previous research had shown that, and also discussion with people who know far more about vocabulary and vocabulary intervention than I do, said that standardised tests do not tend to pick up vocabulary difficulties, and they are not good to measure change. You really, particularly change in short periods of time, you really need to use a bespoke measure. And so that's why I went and looked for a measure like that. Whereas say the task I told you about, when you say a word and you point to the picture, that will tell you if there's a difficulty there or not, but it doesn't guide intervention, and it's not sensitive enough to change. So that was probably the other thing, was the use of that bespoke measure, and having 2 pre-intervention measures.
They were good baselines, really, weren't they, as a control for maturation? It was kind of... Yes. As you describe it, sorry to interrupt there, but I just want to say, you've described all these elements of what you've done in a case study, and you've just amped it up by having these standardized measures, and it's almost, it's prospective. So you are you've controlled for maturation by using those.
Yeah.
By using that, like how many case studies would you have? Would you have that, confidence in knowing this is where the child is currently performing? And I love how even when you said, okay, it was a pragmatic reason for choosing it. But if these are the cases where, because everyone's so individual, you can't put them into groups and try to compare because everything's going to wash out in the means.
Yeah.
So
it's so variable.
It is so variable. So I love that in everything you've said that. My brain was going bing, 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 so many things. So you've controlled for that. The standardized measures, I love how that was a big thing that came out in this paper, that it really wasn't that great in picking up change. And so the use, and which makes sense given how heterogeneous it is.
Yep.
And then the bespoke measure, well, that's almost like, single case experimental designs. You do often use them as target behaviours. They are very personalised because it makes sense for that particular child and their unique combination of factors that influence their comprehension.
Yeah.
So I just feel like it was worth going into that because sometimes I think you can read a case study and you can't have a case study and compare it and say they're all the same.
No.
Because you can see it's really robust.
Yeah.
Yes, and that was an issue with the other intervention. So I did another intervention that had the larger group of children that was looking at targeting those higher level language skills, in particular inferencing. And that was the feedback that I got. You know why? Because I did that as a series of single case designs.
Yeah.
And the feedback from reviewers and things was, where's the stats? Where's the stats? And I'm saying, well, no, you can't. If you collapse it into a group, then yes, you will just get average performance. And because they're heterogeneous, you can't really look at them that way. Yeah. And I think the other nice thing about this particular measure that I found is that it had some measures of phonological skills. So the child had to repeat the word and spell the word, and I think of a rhyming word was the 3 tasks. So it had some phonological tasks as well as some word meaning tasks, and the child she performed at ceiling or close to ceiling on all those phonological tasks, which fits in with the profile of poor comprehenders. Yeah. So it was really, even within that measure, we could reinforce that her phonological skills were intact. It was her vocabulary skills that were weak. So it was a really nice measure. And thanks to one of my co-supervisors, we could actually do some stats on the measure, which was wonderful.
Fabulous.
So we could actually see that the change that occurred in those measures across time was actually statistically significant, which was lovely.
Yeah. Let's touch on the intervention then, which was a big part of the case study. So what did you include in your intervention, and how does that compare to what is currently done in clinical practice?
So probably in terms of the structure of the intervention, it's not that different to clinical practice. This idea of working on semantic organisation is something that's well known in language fields. So the idea that, I suppose, if you think of words kind of having layers in a way, people love talking about layers of onions and things like that, but it is a little bit like that, So you have your word, and then let's say the word shoe. Can you think of an associated word? So shoe goes with sock, and then moving further out, can you give a definition of that word? Can you think, or that's far out. Can you think of what's a closer skill? Similarities and differences. Can you just say, so a related word is shoe, sock. Can you say how those words are the same? How are they different? Then can you give word definitions? So that's not new in language intervention at all. So we call that a semantic organisation approach. So that's something that people would be familiar with. I suppose what was different about this intervention was the way the words were selected. So I actually had gone through some age and reading age, which was the child could decode words at her chronological age. So I had selected words out of texts that were these harder words. So we refer to them as tier 2 words. So they're words that are used more in writing. So tier 1 words are everyday words, and tier 2 words are the more descriptive words and words that we see much more in written language, which is one of the reasons that written language is much harder to comprehend often, and picked out these words and got her to rate her knowledge of them. So I've never heard of the word to I know the word well and I could use it. So it was a 3-point scale, and then I developed or selected the words to go in the treated list, and then paired them with similar words in terms of the level of knowledge and the part of speech, so whether they were a noun or a verb or an adjective, and had a list of untreated words. And so the structure would be of the intervention in terms of that word selection and how they were dealt with would be different to what you would do in a clinical context.
Right. And that's the way you've described it matches the sort of theory that you've put behind it. And I guess that gives clinicians a bit of a structure around, how they might problem solve for each individual. And I saw that when you did this intervention, it was 2 30-minute sessions over 8 weeks, which is, it's very practical. It's something that could translate.
Yes.
And I guess from what this means from a practical perspective and the outcomes, what would you sort of say in terms of what were the main take-home outcomes from this intervention, would you say?
I think that you could see change. There was change evident in that relatively short period of time. One of the real issues with vocabulary interventions, while people talk about how vocabulary is critically linked to reading comprehension, and of course that makes sense. Just not even at a theoretical level. We say that and you go, oh, that makes sense. But in fact, there's very little evidence to see that working on vocabulary affects change on standardised reading comprehension tests. So most studies that have been done, you can see improvements in vocabulary on the treated words, and so that the idea of that transfer to untreated words was really nice to see in the intervention that I did too. You can see improvements on comprehension texts that include the words that have been treated, but it isn't that common to see transfer to standardised reading comprehension tests. So that was one of the really positive outcomes, and probably the best outcome in terms of the outcomes for this particular child. That's where she progressed the most. And it's interesting, and because of vocabulary, how many words do you teach? You can't just teach individual words and expect improvements in vocabulary. It just doesn't happen like that. So what you're trying to do, I suppose, is almost stimulate that vocabulary system. And some of the research into vocabulary interventions has looked at picking up on key words that are used, particularly with high school students, words that are used perhaps in a subject area, or words that instruction words and things like that, and that can make a difference to comprehension.
I'd love to talk about what this case study means for clinical practice and future research. One of the things that I loved about the intervention is, the 2 30-minute sessions. I think that really speaks to your experience in the education sector, and the fact that that's something that could be easily implemented, into the education setting to support these children. But what are some of the other implications for clinical practice?
Well, again, I think it's that, there's a structure there. If you're talking about clinicians, there's a structure and you can just slot your words in and follow that structure. So it's something that can be picked up and run with quite easily. It would be, in terms of future directions, it would be really nice to see how it could be implemented in a classroom context rather than just a clinical context. What are the other implications? I think that this was just a single case study, but that you did see change in reading comprehension, which was really positive. And there hasn't been much done on. It hasn't been much research on specifically with poor comprehenders, but the one other well-structured intervention study there was also felt the indication was that vocabulary was the driver to the improvement, although it wasn't specifically just working on vocabulary. And that was another study that did see some shift on standardised reading comprehension tests. So I think that's the other positive one from a clinical point of view. That you can pick it up and run with it, and hopefully, if it, when you do it, you'll actually see improvements in reading comprehension.
And I think, Katrina, that's great because that's the point. So people can pick up this article and read through the protocol. I mean, we've discussed it here today and what the main points are. But for people who want to carry this out, it's written there and people can follow that as a structure. So I guess maybe to put it all together now, we are going to go to the next segment, which I know you're very much looking forward to. And it's called Tell It to Ed. So Ed, as you know, is our producer. He doesn't have a background in child health, and I'm pretty sure not in this area too. So this will be very interesting for you to summarise this research in about 60 seconds or so. And Ed will in turn have time for a question. So are you ready?
Yes, as ready as I'm ever going to be.
No pressure. All right, no pressure, but just 60 seconds. All right, take it away, Katrina.
Right. So I suppose the first point is that comprehension is the goal of reading. So with this group that I was exploring here, they were called poor comprehenders. So these are children who can read accurately and fluently, but they struggle to understand what it is that they've read. Some of these children have difficulty with vocabulary, understanding vocabulary and grammar, so sentence structure, as well as having difficulty understanding texts and making inferences and being able to know when they're not understanding. And then a second group that doesn't have those vocabulary and grammar difficulties but has those higher level language difficulties. So I was looking at a child who had those vocabulary difficulties in this and devised an intervention that focused on trying to develop their knowledge of Tier 2 vocabulary words, so those more descriptive words that are used in reading. So I got the child to rate her understanding of different words and then designed an intervention that had treated words and untreated words, and then looked at the outcomes out of that in terms of did improvements occur, and very excitingly for anyone who does research, saw improvements in both on both the treated words and the untreated words, although that was a bit of a delay. So we have to think, did it take her time to actually use those word learning skills to actually apply them down the track? And also really excitingly saw an improvement on her on a measure of standardised reading comprehension. So that was really positive too. And I suppose the outcomes for clinicians is that this is a program that they can pick up and run with. And I think for parents, the takeaway is that if you talk to your children, if you really focus on talking about words that you come across when you're reading to your child, and particularly for children who are poor readers or aren't interested, that you actually read to them and discuss words and build vocabulary, that you can see a real improvement in those skill areas.
Great.
Was that 60 seconds?
Wow.
Well, I would say maybe a little bit more than 60 seconds, but it was a very good, comprehensive summary. Thanks, Katrina. All right, Ed, over to you for a question.
Well, that was a very interesting a conversation. And I think before I make a bit of a goose of myself, I'm trying to establish what's the prevalence of kids with young people with comprehension difficulties. Is it getting worse or is it getting better?
Oh, gosh, that's a minefield.
Okay. That was probably the precursor to what I was going to ask about. In terms of this particular group, and for poor comprehenders, it really, the prevalence rates have varied over time depending on what your cut-off criteria are. Okay. So that's always what you're looking at. But the consensus for this particular group who can read accurately and fluently but struggle with comprehension is around about 7%. But it does, the prevalence rate does increase over school years. So that's because the texts get more difficult and the demands of the tasks that the kids have to do gets more difficult. So there's not a sort of fixed answer to it. And if you're talking about is it getting higher, then we're into the discussion about screen time and all sorts of things like that. And that's actually where I was going to go.
Yes.
Right. Okay. She knew.
Do we need another episode?
Yeah, no,
I feel like we do.
I feel like it's deeper.
Yeah, that's a minefield I'm not going to go into.
I guess my question to all of that is, and for listeners' reference, I'm getting towards the 5-0 mark in life. And so I remember a time before all things social media. And with the advent of social media, we've kind of gone from sharing long-form stories and now to, the world of Twitter and TikTok where messages get kind of communicated very, very short or in such a small character amount. And my layman's understanding is that, like, people seem to be looking for sound bites, looking for the easiest, tiniest little explanation for something without fully comprehending or going deeper into items. And I wonder whether that broadly has an effect on comprehension and communication and all the rest of it.
Oh.
The short answer is yes, and there's actually some people doing some research in this area because it's not necessarily strictly a comprehension thing, it's an attention thing because we get the information in little bits and pieces. And then we're distracted by things, and certainly with phones, you just, if it pings, you're doing something and you ping and it distracts you and what have you. And there's a woman called Dr. Marianne Wolfe, and she's certainly been talking about this whole area that we are not reading as deeply as we did before. And we are losing the art of actually sitting down and reading deeply and comprehending deeply text because of all these distractions that are in our lives and because of the way information is presented to us in little bites and, cross screens and things like that. So, really good question.
Oh, Ed, you're the carry-owner champ of good questions.
Oh, fantastic.
He is, isn't he?
Well done, Nat. I love it. Now we all know what that means when you say it. That was a good question. Thank you, Katrina.
Yeah.
Gosh, that was a good conversation.
A great conversation.
Yep.
Thank you so much, Katrina. And thanks for giving up
That's
your late evening to talk with us. We must let you go so you can go and get some rest.
I'm usually in bed by this time if I'm thinking back 12 hours ago. So yes, thank you so much for your time, for going into the detail for us. Obviously this is an area that we're not familiar with. So thank you for teaching us. And to all of our listeners, remember if you want to get a copy of this paper, really worthwhile looking at, reading, please head to our website, ResearchWorks.net, and there'll be links there to this particular paper. And of course, as usual, there's a CPD form there that you can fill out as well if you want to keep this as part of a record of your PD requirements. For now, thank you.
I have to say goodbye.
And goodbye. Thank you everyone for listening. Thank you so
Thanks.
much for joining. We'll talk to you all again next time.
Thanks, Katrina. Bye.
Bye.